Hello and shalom, friends. This is Mayim Vega, your naturopathic herbalist, and I would like to share with you today Dr. Brownstein's iodine protocol as I was taught. Now, when it comes to iodine therapy, Dr. Brownstein stands tall as the foremost expert in the field. With years of experience and a track record of successfully helping patients restore their iodine levels and regain their health, he has uncovered a powerful set of nutrients that work hand in hand with iodine to support the healing process. So, welcome to Dr. Brownstein's iodine protocol. And before we get started, let's list some common problems associated with iodine deficiency, as reported mostly by I can't pronounce his name actually, Wojciech Reichlich, PhD, of the Orthomolecular Medicine News Service. Now, the Orthomolecular Medicine News Service is edited by my teacher in orthomolecular nutrition, Andrew Saul, PhD. Now, Mr. Reich, is it Reichlich or Reichlich? Mr. Reichlich states that iodine deficiency is associated with things such as fibrocystic breast disease leading to breast cancer and stomach cancer, goiter or enlarged thyroid. In my case, I have hypothyroidism, and even hyperthyroidism or Graves' disease can also be associated with iodine deficiency. Most people are iodine deficient in our world today for various reasons, which we won't talk about in this lesson. Anyways, other issues related to iodine deficiency are mental issues from reduced alertness, lowered IQ, autism to cretinism, lack of iodine for the fetus, which leads to cretinism, and in milder cases to autism and ADHD. Slow metabolism leading to tiredness, sluggishness, fatigue, apathy, depression, and insomnia, inability to produce saliva, dry skin, and lack of sweating. Personally, part of my hypothyroid symptoms were my eyes would get very dry. Lack of optimal detoxification, especially of bromides, fluorides, and heavy metals, also chlorine. Sensitivity to temperature changes, cold hands and feet. This was an extreme symptom that I had from my hypothyroid attacks. Also muscle pain, fibrosis, fibromyalgia, erectile dysfunction, infertility, and miscarriages, low sex drive. Also prostate diseases, BPH and prostatitis, overweight, high blood pressure, increased incidence of heart attacks and strokes. That's a lot associated with iodine deficiency. That doesn't mean that iodine alone will cure all these things, but certainly improving your iodine will help with these issues. And it can help quite a lot, actually. And what I love about iodine is it's very cost effective. It's extremely affordable, low cost, and available on Amazon. Now, before we dive into the nitty-gritty of this protocol, it's important to understand its essence. A protocol is like a set of instructions and materials used to properly utilize something. In the case of iodine supplementation, it's about more than just throwing a few nutrients at tired and hungry cells. It requires a thoughtful approach to address digestive issues, nutritional deficiencies, and ensure the proper utilization of iodine. So if you have a specific issue, we don't want to just do iodine. We don't want to only do even just the supporting nutrients. When I provide health coaching to people, I educate them on, of course, the foundations of holistic health and healing that they may be missing out on. I help to identify toxins that they may be, that may be affecting them and aggravating their condition. Also talk about proper diet and nutrition, as well as herbs, natural herbs, and other supplements that they can use to help support them. Okay, so back to the supporting nutrients that make up Dr. Brownstein's iodine protocol. Okay, so let's get started. First, of course, there's iodine, which is the star of our show. And iodine takes center stage in this protocol. Dr. Brownstein used to start patients at 50 milligrams of iodine, but recent adjustments have led to lower initial doses, like 12.5 milligrams. It's important to start with a dosage that feels comfortable for you and gradually increase it over time. I personally started with just one drop of Lugol's 2% solution, which is about 2.5 milligrams of iodine. And I increased my dose every few days until I felt good. I am now at Dr. Brownstein's therapeutic dose of 50 milligrams, and I feel good. I know I could not have started at that dose because even when I started with just one drop per day, I felt it was very powerful. I got what they call the iodine bing, where it's kind of like, that shock that you kind of feel mentally when you've been in a dark room for a long time and all of a sudden there's bright lights, right? That just turn on and kind of blinds you a little bit. Well, I felt that not visually with my eyes, but just kind of internally. I felt, and there's a name for it. That I think it's, if I remember correctly, it's called the iodine bing, and I felt it. So when I started with just one drop, I was like, whoa, that's powerful. And I stayed at a very low dose for a long time until I finally started venturing out because I felt like, I need more. And so I gradually, increased my dose every few days until now I am at 50 milligrams of iodine per day. And 50 milligrams of 2% Lugol solution. I want to show you what it looks like. Right now I have a bottle of Carlisle Lugol solution, but the recommended brand really is J. Crow's. That's what most therapeutic iodine practitioners recommend is J. Crow's brand of Lugol's iodine. Lugol's is a type of solution. Carlisle is one brand for it, but J. Crow's is really my preferred brand. But I was in a hurry, so I just got this for now. Anyways, I personally, this is what I do right now at 50 ml. I didn't start out this way. I started with just one drop. But now I'm taking 20 drops, which is about a whole dropper full. It's almost a whole dropper full, full of this 2% Carlisle Lugol's iodine. And this is 2 fluid ounces. This is a 2 fluid ounce bottle. But I do count it and I take one full dropper. Sometimes there's not a full 20 drops. Sometimes there's just 19 or 18. And when that's the case, that's fine. I just do 18 or 19. I don't fuss too much about it. And so I fill up a glass bottle of water. This is a kombucha bottle, but I labeled it. I wrote iodine right here on it so everyone knows this is my iodine water. And I fill it up with water and I put a dropper full, which is around 18 to 20 drops of iodine, 2% solution in this, and fill it up with water. And I drink it up throughout the day. By midday, I like to make sure I have at least half of it finished. Maybe if I drink maybe about a quarter of it in the morning and I keep sipping it until midday, I should have about half of it finished. And then I keep sipping it some more. And then I finish most of it by about, I try to finish it by dinner time. Usually after dinner, I just have a little bit left like I do right now. And I just drink it throughout the day. It's just my iodine water. I've gotten used to the taste. And I have 2 children that I'm also giving it to for various reasons. And I just have, they don't take a lot. So I just have them take little sips from this. So that's what I personally do for my iodine. Okay, now let's also talk about selenium. This essential trace mineral is a key player in iodine utilization. And the dosage ranges from 200 micrograms to 400 micrograms. You don't need to go much more than this, even if you increase your iodine dosage. It's worth noting that some individuals may already have high selenium levels without supplementation. And if you want, you can order a selenium test, which you can do from home from Amazon. And but really 200 micrograms to 400 micrograms is quite low. I've heard of people going all the way up to what is it, maybe 2000 micrograms. I think that's, you don't need to go that high. I wouldn't go past 400 micrograms unless you get yourself tested to make sure you need more than that. Okay, so just 200 to 400 micrograms. And I just take that in a pill form in the morning. There's also other supporting nutrients, vitamin C, um, uh, and Dr. Brownstein's protocol is the recommended dosage is 2,000 to 5,000 milligrams. I personally take more than that sometimes if I need it, if I'm feeling like I have an infection or something like that. Also unrefined salt, half a teaspoon, but pink salt is the best. There's also um, Celtic sea salt, but I don't take a half a teaspoon. I just salt my food to taste. And also magnesium, 200 to 400 milligrams, and vitamins B2 and B3. Now, I do have a book that I'm currently writing, but I have it published, even though it's not finished. The book is called The Essential Guide to Everyday and Emergency Supplements, aka the top 10 supplements you need every day and when SHTF. Now, if you'd like, a little bit more info on iodine and my other top 10 recommended supplements, just go to arukah.com, arukah.com/top 10, TOP10, and you can get the book there. And whenever I write a new chapter, I do publish it online at that location. Okay, so just wanted to make that quick video for everyone. Shalom.